U.S. Global AIDS Coordinator, Ambassador Deborah Birx, shares new PEPFAR HIV prevention and treatment targets to achieve an AIDS-free generation.
At the end of September, President Obama at the Sustainable Development Goals Summit announced very aggressive new targets for PEPFAR. We're very excited about what those will mean for individuals and the lives that will be saved, but also how it will change the very course of the epidemic. He announced that we will have 12.9 million individuals, mothers, fathers, children on treatment by the end of 2017. 13 million circumcisions to be completed by 2017. And I think the most aggressive, the most ambitious, and the new impact target will be to decrease infections in young women by 40% in the highest burden countries affected by HIV/AIDS. Why is this important? Because of the Millennium Development Goals being very successful, we have 30% more adolescents in sub-Saharan Africa than we did at the beginning of this epidemic. Yet we haven't really changed their rate of infection. So when UNAIDS put out the fast track document that said we're headed to 28 million new infections within HIV, a lot of that, and a high proportion, are coming from this growing youth bulge, which is a real advantage to sub-Saharan Africa if we can keep them collectively HIV free. So having this impact of decreasing the number of infections in young women and preventing infections in young men through circumcision, we can change the very course of the epidemic and at the same time ensure that we're treating those in need. Because behind each one of those numbers, there's a mother, a father, a teacher, a doctor, a community health worker, a child that is HIV positive that now has life-saving treatment so they can thrive with HIV. Just as we have seen domestically in the United States, individuals thriving on their treatment, people are thriving in Africa on their treatment, and this is leading to economic growth and development, and Africa is soaring because of the ability to control these infectious diseases.
For more information on global efforts to reduce HIV infection, visit blog.aids.gov.